My name is Dr. Jeffrey Gross. I'm a spine fellowship trained neurological surgeon in Orange County, California. I have interest and specialty in spine surgery, specifically minimally invasive small surgeries to help the low back with less invasive and less open surgery when possible. Well, MIST stands for minimally invasive surgical technologies, and the M for minimally and the I for invasive speaks for itself. This is a smaller surgical procedure that we can do for patients who are candidates to have a Band-Aid sized incision and a quicker recovery with less invasive, less destructive exposure of the spine. This is most commonly used for cleaning up disc herniations, or what are commonly referred to as slip discs. Which is a case I'll show here shortly. But coming is smaller applications of fusion surgery, which is a stabilizing surgery with hardware, which can now be done to smaller incisions more effectively. The present case is someone we just finished treating here in the operating room with a large herniated disc. And on the side view here of the spine, one can see the vertebral bones of the spine and the sacrum or upper tailbone, and the nerves coming down the spinal canal. The darker elements between the bones are the cushions or the discs. One of the discs has frankly slipped out a large piece. It looks like a grape has come out of the disc, pressing on the nerves going down the spine and eventually down the legs. And this patient had significant back pain and shooting pain down the legs to the feet. So a small incision was done on the back, about 18 millimeters, which is about 3/4 of an inch. And a small tube is placed and a microscope is used through that tube. And this is the minimally invasive approach. And we were able to make a small opening and remove the material that's herniated, since it's no longer functioning as part of the cushion any longer. And surgery took about 2 hours. The wound is closed with a little super glue. Patient can shower the same day and should go home improved. Minimally invasive surgery is a growing movement with the use of robotics and small incisions, microscope, and fiber optics. We can do a lot more through a little approach. So we have to take what we've learned from years ago and make it in a smaller package, not unlike electronics. Similarly, patients are looking for a quicker recovery. It makes surgery more doable in their lifestyle, getting back to work quicker, less pain during the recovery perhaps. You might hear terms out there like laser spine surgery and things like this. There really aren't safe lasers to use because the heat can injure the nerves, but this type of approach through minimally invasive and microscopic surgery is a nice alternative for what we used to do in a more open setting. Patients ask about lasers all the time. We don't really use high-powered lasers in the spine because the energy of the light is dissipated as heat, and heat can injure the nerves. The folks at Laser Spine Institute, which I think you're referring to, are brilliant because they came up with a marketing idea and it's done very well for them. But they offer the similar procedures that we're talking about here. They're minimally invasive. They might use a cold laser, which really doesn't do much, but they can use the word laser. So you might as well just call it free pizza spine surgery. I think that patients considering surgery or a second opinion should look at these options when they're possible. And they're not always possible, but they should at least be evaluated as one concept. And that's why I always believe in second opinions, third opinions if necessary. Well, unless the patient has some type of emergency for surgery, like the foot doesn't move anymore or they're losing control of their bladder because of the nerves being involved, anything less than surgery should be tried as much as the patient can tolerate. Different therapies. One of the longest standing therapies described in papyruses thousands of years ago is a decompression or a traction therapy. Think about it, we're on our feet all day long putting pressure on our discs, okay? And if you ever notice, during the night we actually get a little taller, and that's why you have to adjust the rear view mirror every morning when you get in the car, because you're taller in the morning and then you're shorter at night. Be that as it may, any treatment or technique to help offload the spine, traction or distract the spine, or decompress the spine non-surgically is great. If a course of that can help the pain and even prevent surgery of any kind, that's a a win. That's someone we don't have to operate on, since surgery is really the last option.